It's important to understand what the cause of delayed ejaculation is so that you can properly treat it. And yes, you can treat delayed ejaculation. The reason I learned so much about sexuality really started with my own issues with orgasms, and I talk a lot about it in earlier episodes. I learned about the psychology and the physiology and what causes anorgasmia, which is what I was experiencing. What is really interesting is as men age, they have similar issues. Their causes might be different, but they definitely experience difficulty with orgasm, and I have seen it for myself.
That's right.
In this episode, I'm going to address delayed ejaculation, which is when it takes you a really long time to ejaculate. There's also something called retrograde ejaculation, which is when you can orgasm, but you don't ejaculate. I'm not going to be addressing this, although that is something worth investigating if it's a problem for you. Delayed ejaculation can be extremely frustrating. It can affect your relationship in many ways. It can affect how your partner feels. They may think there's something wrong with them. It might be a physiological problem that becomes a psychological problem, and because you're anticipating that you're going to have the problem. It's important to understand what the cause of delayed ejaculation is so that you can properly treat it. And yes, you can treat delayed ejaculation. Let me first make very clear that there is no right amount of time that it should take you to ejaculate. Clinical guidelines are 20 to 30 minutes to ejaculation, 75 to 100% of the time in the last 6 months that cause distress. But if it's taking you twice as long or 3 times as long and that is causing you distress, then it's something that you want to deal with. A 2023 study estimates that delayed ejaculation affects at least 5 to 10% of all males, and I suspect that number increases as men age. So you're not alone. This is not a unique problem. You should not be embarrassed. It can be caused by physiological issues, changes to the body, or psychological issues, or the two combined. In terms of physical causes of delayed ejaculation may be caused by nerve damage. You may have had surgery that caused the nerve damage or some other kind of surgery that somehow created some blockages in that area. Certain medications like antidepressants and even blood pressure medication can affect your ability to ejaculate. Thyroid problems, decreases in prolactin, those are other issues. If you have diabetes, that can definitely contribute to your ejaculation ability. If you've been drinking a lot of alcohol or taking a lot of drugs, that will also affect your ability to ejaculate. Prostate problems can lead to delayed ejaculation and other issues. And as you age, your testosterone levels do go down, and that may reduce your sensitivity and affect your sex drive. In terms of psychological issues that may be causing delayed ejaculation, you might be feeling guilty about having sexual intercourse, whether it's from a religious upbringing because you're having it out of a relationship, or you're in a new relationship after a long marriage, or you're just uncomfortable with your partner or angry with them. Maybe you're afraid of getting an STI. Maybe you've got performance anxiety. If you've suffered from erectile dysfunction in the past, you may get in your head that you can't ejaculate and you're always going to have this issue. If you watch a lot of porn, you might need a certain kind of visual stimulation that you're not likely to get. Remember, porn is movies, it's not reality. And lastly, if you're masturbating with a very strong hand and you try to ejaculate through intercourse, it's not likely that you're going to get the same kind of stimulation as you get when you use a very strong grip of your hand. How do you treat delayed ejaculation? Well, it depends on what the issues are. Has this been an issue for you for a long time and you've just been embarrassed to talk about it? Or is it something that just started? Is it something that you had your whole life, you were never able to orgasm? Or is it something that happened as you age? Has something changed that could be contributing to the problem? Is there a new medication that you're taking? What about the situations in which this occurs? Is it related to a particular person or a particular place where you try to have sex? When did you first notice it? Do you have other issues like erectile dysfunction, or have you ever suffered a small fracture in your penis and you just didn't want to deal with it? You were too embarrassed. In terms of helping treat this for the physical issues, you're going to want to find ways to increase the sensitivity of your penis. It can be adjusting your masturbation behavior, so teaching your body to respond to lighter touch. It could be adding testosterone, which will help but won't cure the problem. It could be a little bit of both. And I always recommend using lube when you go for partnered sex because that makes everything feel better. If it's related to your relationship, then perhaps some couples therapy would help.
Tried sexy lingerie, some lacy underwear?
I've tried wearing them all. They don't work.
If there is a physiological problem that's become psychological, or you've got some emotional trauma around sex, then a sex therapist who specializes in male sexual dysfunction can really help you. Delayed ejaculation is not a lifetime problem. Whether it's a physical issue or an emotional or psychological issue, the good news is there are ways of helping you enjoy better sex and have better orgasm.